According to Winston's Wish Foundation website, in the United States, 67 children are diagnosed with autism every day. That's one case every 20 minutes. Autism is a familiar term that is used to describe a mental condition that characterizes itself with symptoms that inhibit social and communication skills. With rapid spike in diagnosis, it's a condition that most people have heard of. Autism is a treatable, lifelong condition that holds no guarantees in its outcome, however shows improvement with functional treatment plan and support. In just 2 years, autism diagnoses have increased by 30%. With this alarming statistic provided by CNN's website, it is clear that autism is a growing problem in the United States. Necessary treatment, early intervention, and parental education are vital for the best outcome in managing the symptoms of autism. As a parent of a severely autistic, nonverbal 6-year-old son, I am immersed in this world on a daily basis and understand the importance of knowledge of the disorder and treatment of it. Today I'd like to discuss common symptoms and treatments. Let's begin by looking at common symptoms. Autism has a broad range of common symptoms, one being developmental delays. Developmental delays at a young age usually present in the form of loss of language or no language at all. Commonly, toddlers will speak a few words and gradually lose those words. Never learning to speak or utter first words is commonly the first symptom of autism in babies. Another developmental delay is lack of interest or interaction. Toddlers often play by themselves, show no eye contact with others, and keep to themselves. Additionally, to add to lack of interest, they show very little desire for affection. Recognizing developmental delays are vital to early diagnosis and intervention. However, autistic children have additional symptoms that are unique to the disease. Self-stimulation behaviors, or stimming, as it's commonly referred to, are often present. Hand flapping is a very common stimulatory behavior and one of the red flag behaviors. First Science website defines red flag behaviors as a behavior that is an absolute indicator of autism. Children often flap their hands in excitement, anger, and frustration. Hand flapping is most common when the child cannot express what they need and fail to express proper emotion. Auditory stimulation is another example of stimming. Children often tap their ears for sound stimulation. Children often cover their ears to alter sounds and accommodate their stim. These are just a few common examples of behaviors of autism. The perplexing symptoms of autism often leave people wondering where the condition comes from. Finding an exact cause for the disease is continuously being researched. Causes of autism are generally unknown at this time, with only a few contributing factors. Research is constantly being done. However, tying things together, such as maternal age and vaccines, are still not completely proven. The CDC reports that advanced maternal age and taking certain medications during pregnancy are possible risk factors. Autism Speaks reports that vaccines have been speculated and debated over causing this disease for years. The correlation and timing with developing symptoms of autism have led many parents to believe that that was a lone cause. No correlation has yet been proven. While causes are still unknown, we turn to treatment of the disease. There are multiple common treatments for autism, beginning with early diagnosis and a proper diet of therapies. Applied behavior analysis is one of the most common therapies. This therapy helps the autistic child redirect unusual behaviors to positive ones. This therapy reshapes self-stimulatory behavior and redirects them to functional, productive therapy. An example would be, instead of constantly hitting their head, maybe they would be taught to clap their hands or squeeze a pillow. Additional therapies such as speech-language therapy and occupational therapy, used in concert with ABA, will maximize a positive outcome. Speech therapy focuses on language skills and possible use of sign language. Occupational therapy will generally aid in improvement of fine motor or motor skills such as eating with utensils and coloring. Overall, these are a few of the options commonly used in treatment. So let's review. Overall, autism is a growing problem here in the United States. Without proper diagnosis and treatment, the outcome is bleak and managing symptoms is difficult. Recognizing symptoms and red flag behaviors such as flapping and stimming at an early age are crucial for managing this condition effectively. Causes of autism are constantly being researched, but are widely unknown and unproven. In the case of autism diagnosis, therapies such as speech and behavior analysis help to improve the quality of life and independence of newly diagnosed. In the words of Rachel Barcelona, everyone has a mountain to climb, and autism has not been my mountain. It has been my opportunity for victory.